You know what drives a clinical psychologist who has done lots of research on suicide absolutely nuts? The myths surrounding suicide. So on this episode, we will be discussing the 3 most common myths about suicide, which a lot of my work as a clinical psychologist touches on. And if you or someone you know is in danger or is thinking about suicide, please call 988. That's a suicide hotline. Someone will answer and someone will talk to you. It's open 24/7, 365 days. All right, so let's get into these myths. The first myth is if you ask someone or talk about suicide, it's going to plant a seed and that person is going to think about suicide even more and they're going to think about taking their own lives. This is a myth. It is not true. We don't want to continue to perpetuate this myth because it's not true. And what we actually want to do is if we have even an inclination that someone is thinking about suicide, you want to ask them these 3 questions. Number 1, are you thinking about killing yourself? Number 2, do you have a plan to kill yourself? And number 3, do you have the means to carry out that plan? Now, I get it. These questions can make people extremely uncomfortable, but I know from personal experience that it saves lives. I remember I was driving home and a colleague called me and they were concerned about someone that they knew. And I was like, go to their apartment immediately and ask them these 3 questions. Later on that day, that colleague called me and she let me know that they had gone to the person's house and they asked them the 3 questions. And what they heard was super unnerving. Yep, as soon as you leave here, I'm going to do X, Y, and Z. And the person was like, okay. Then Dr. Mata said, take them to, call the ER or go to the ER. And so the person went to the ER and now the person is still alive and they're doing well. Again, these questions are uncomfortable, but they save lives. So that's myth number 1. Myth number 2 is depressed people are more likely to die by suicide. Again, this is a myth. For every 600 people who are depressed, only 1 attempts suicide. And so, because a lot of the time, depressed people who are experiencing significant levels of depression, the ones that aren't able to get out of bed, they don't want to do anything, they don't have the energy to carry out suicide. Now, remember, I'm talking about in generalities here. It's not in every single case, but they don't have the energy to carry out all that goes into suicide. And so what we need to be more aware of is that when they're coming out of a significant major depressive episode, that's when we should be concerned about their suicide risk, because that's when they're going to have energies, they're starting to feel better, but they're not completely there yet. And so that's when we want to be concerned about someone's suicide risk. All right, myth number 3. Giving away prize positions, call in, red flag, red flag, red flag. How many times have we heard this? Giving away someone's prize possession is a red flag and we should send in the troops. No, it is not. And I'll get to that in a different video about individuals who are thinking about suicide. But no, this is not a warning. I mean, it can be a warning sign, but it's not like one of the warning signs that I usually am concerned about. The phrase that I usually use when I'm thinking about warning signs when it comes to suicide is path warm. We want to look at suicidal ideation. Are they thinking about it? Are they talking about suicide? But we want to be able to tease apart what I call experiential suicidality or suicidal thoughts, which is I wonder if the world would be better without me. And thinking about that, you have to really tease apart. You have to know the person to tease apart ideation from more along the lines of experiential, strife kind of going on. The second one is substance use. So is their substance use significantly increasing? Are they drinking more? Are they smoking more than they typically do? Have in the past. The third one is purposelessness. They feel like they have absolutely no purpose in life being trapped. They're in a situation where they don't think no matter what they do, they can get out of. Hopelessness. They've lost all hope. Withdrawal. They're starting to remove themselves and move back and, isolate themselves from their friends and their loved ones. If they have a significant increase in anger or anxiety, that's going to be another thing that we want to kind of pay attention to. If they start to get restless and so they're never sitting down, they're always kind of moving and they're busy, they're going, that is a concern. And then mood changes. So they are significantly changing their mood from what it typically is. Now, none of these alone should send up, we should not be sending in the troops for just one of these alone. If we start to see multiple ones of these piling up, that's when we want to start having conversations, maybe go back up to those 3 questions that we want to ask. And that's when those are the conversations we want to be having if we're seeing multiple of these. And then even then, I think one of the things that people struggle of, and I know this personally, is that if someone that you know dies by suicide, the guilt that you feel because you didn't see it. And here's the thing, I've been trained on suicide. I was on $1 million grant on suicide. And I once had a friend where I missed 80% of these warning signs that I just gave you. Granted, she lived 6 hours away, but I missed 80%. She had 80% of these warning signs and I missed it. And so I struggled with that when I got the word. So these are the 3 myths. If you talk about suicide, it's going to make people think about suicide. Depressed people are much more likely to commit or die by suicide. And then giving away prized possessions, send in the troops. These are all myths. This is the first one out of 4-part series answering most common questions regarding suicide and how to prevent it. So stay tuned for the whole month of September, which is Suicide Prevention Month, where I'm going to give practical tips to start stomping out suicide and throat punching this Gen Z mental health crisis.